Techniques, interventions, adjustment disorder, coping skills training, crisis intervention, psychoeducation, stress inoculation, solution-focused therapy, problem-focused therapy, DBT, dialectical behavior therapy, agoraphobic disorder, panic control therapy, exposure therapy, flooding, systematic desensitization, imaginal, alcohol use related. Techniques and interventions include cognitive behavioral, cognitive, cue exposure, urge coping, self-control training, brief motivational interviewing, stress, supportive expressive therapy, exposure prevention, homework, cognitive restructuring, maladaptive thinking, relapse prevention, problem solving, social skills training, interpersonal therapy, ITP. Anorexia nervosa, Mosley's model, family organization and interaction, facilitate eating and weight gain, parables, paradoxes, personal authority, rationalizations, psychodynamic interpretation, homework, attention, deficit, hyperactivity, behavior, parent training, contingency management, teacher reward, point systems, timeout, family therapy, social skills training, anger management, communication skills, recognition of nonverbal, time management, borderline, personality, BBT, Behavior Classroom Management, BCM, summer-based treatment programs, autism spectrum, social development, focusing skills, sensitivity to cues, modeling communicative skills, predictable play. Bipolar disorder for adults. Medication is the first line of techniques. Family psychoeducation, family-focused psychoeducation, interpersonal therapy and social rhythm therapy, IPSRT with social rhythm, circadian rhythm, family-focused therapy, body dysmorphic disorder, verbal expression, stress management. Bulimia nervosa, cognitive behavioral therapy, routine eating, structured eating, monitoring of food intake, expose-based methods, weighing, cognitive restructuring, food diaries, conduct disorder, social skills training, relaxation exercises, impulse control, negative talk, family therapy, active attention skills, active ignoring skills, parent training, setting limits, physical affecting, attention, planned ignoring, depression, bibliotherapy, cognitive therapy in group format, interpersonal psychotherapy, ITP, problem solving, delirium, support for caregivers, relaxation training, coping skills, eating disorders, mindfulness and acceptance, cognitive behavioral, routine weighing, food diaries, exposure, structured eating, behavioral experiments, factitious disorder, reduction in self-injurious behaviors, coping skills, generalized anxiety, GAD, cognitive restructuring, relaxation training, emotion regulation, exposure techniques, problem solving, muscle relaxation, guided imagery, diaphragmatic breathing, expressive therapy, systematic desensitization, CBT, ACT, cognitive, insomnia, CBT, sleep hygiene, sleep diary, relaxation exercises, muscle relaxation, autogenic training, sleep scheduling, sleep restriction, paradoxical intention, thought stopping, and problem solving, intermediate explosive disorder, stress management, impulse control, distraction, relaxation training, systematic desensitization, habit reversal, problem solving, real life conflict situations, major depressive, cognitive, CBT, interpersonal psychotherapy, mindfulness based cognitive therapy, behavioral couples therapy, BCT, exercise therapy, light therapy, medication, marital distress, problem solving, BMT, contracting, communication training skills, obsessive compulsive disorder, CBT, cognitive behavioral therapy, ACT, acceptance and commitment therapy, exposure, cognitive restructuring, mindfulness, response prevention, ERT, acceptance, diffusion, self as context, present moment awareness, committed action, habituation, para intervention, relaxation training, oppositional defiant disorder, social skills training, problem solving, active attention skills, active ignoring skills, parent training, setting limits, physical affection, attention, planned ignoring, panic disorder, panic control therapy, psychoeducation, relaxation training, cognitive restructuring, cognitive reappraisal, controlled breathing, diaphragmatic breathing skills, in vivo exposure, imaginal exposure, i.e., symptom induction exercises, exposure therapy, interoceptive exposure, mindfulness, brief supportive therapy, ACT, paraphilia disorder, stress reduction, aversion therapy, covert sensitization, thought stopping, extinction, cognitive restructuring, contingency management, aversive conditioning, personality disorder, psychoeducation, cognitive behavioral, DBT, schema therapy, attachment therapy, mentalization, phobic, and anxiety, in vivo, imaginal, behavioral exposure, bibliotherapy, ACT, post-traumatic stress disorder, psychoeducation, prolonged exposure therapy, imaginal, imaginal exposure, stress reduction, exposure therapy, stress inoculation, adaptive coping, DBT, ACT, eye movement desensitization, reprocessing, EMDR, as well as stress reduction, schizophrenia. Techniques include cognitive behavioral social skills, problem solving skills, social skills training, family psychoeducation, separation anxiety disorder, anger management, parent management, and problem solving. Sexual disorders, techniques include psychoeducation, couples counseling, progressive relaxation, sensate focusing, systematic desensitization, stimulus control and scheduling, cognitive restructuring, communication skill training. Social anxiety disorder. Techniques for social anxiety disorder include exposure, cognitive restructuring, exposure combined with cognitive restructuring, social skills training, attentional focus training, homework, applied relaxation, anxiety management, mindfulness, flooding, in vivo, imaginal psychoeducation, exposure to fear situation, anxiety coping skills, problem solving, cognitive behavioral models, cognitive group therapy, social effectiveness therapy, SET, interpersonal psychotherapy, IPT. Somatic symptoms. relaxation exercises, as well as sleep hygiene. Now, to look at some other disorders in more details, we'll look at some of the techniques as well as interventions. Acute stress disorder, hypnosis. So some of the techniques for acute stress disorder include hypnosis, cognitive behavioral therapy techniques, Socratic dialogue, self-monitoring, behavior rehearsal, and role-playing, problem-solving skills, modeling, decatastrophizing, what if, reattribution, redefining, decentering, stress inoculation, cognitive restructuring, systematic desensitization, homework, behavior experiments, psychoeducation, bibliotherapy, cognitive reframing. Psychodynamic techniques include transference, exploration of dysfunctional patterns, relational history, discussion of dreams, childhood memories, hypnotherapy, interpersonal psychotherapy, unconscious, conscious, as well as interpretation. Adjustment disorder. Techniques include family therapy, psychoeducational, group therapy, supportive therapy, multisystemic therapy, parent management training, pharmacologic agent, psychoeducational. Cognitive behavioral therapy techniques, Socratic dialogue, self-monitoring, behavioral rehearsal and role playing, problem solving skills, modeling, decatastrophizing, what if, reattribution, redefining, decentering, stress inoculation, cognitive restructuring, systematic desensitization, homework, behavioral experiments, psychoeducation, bibliotherapy, cognitive reframing. Psychodynamic techniques, transference, exploration of dysfunctional patterns, relationship history, discussion of dreams, childhood memories, hypnotherapy, interpersonal psychotherapy, unconscious, conscious therapies.
Someone inside that room. And that's what caused all the problems.
Anorexia nervosa, family therapy, group therapy, psychotherapy, dietary management. Techniques for behavioral therapy include baseline, contracts, diaries, aversion, consequences, reinforcement schedules, incompatible alternatives, flooding, in vivo, biofeedback, relaxation, role play, modeling, assertiveness, token, activity schedule. Activity schedule. Cognitive therapy techniques, analysis of dysfunctional thinking patterns, cognitive restructuring, hypotheses testing, mental and emotional imagery, cognitive and covert modeling, thought stopping, meditation, self-talk, record of dysfunctional thoughts, diaries of events, thought, reaction, argument, letter writing, rating of activities for mastery and pleasure, Beck depression inventory, hourly mood graph, affirmations, systematic assessment of alternatives, grids to evaluate relationships. Psychodynamic techniques, transference, exploration of dysfunctional patterns, relationship history, discussion of dreams, childhood memories, hypnotherapy, interpersonal psychotherapy, unconscious conscious interpretation, antisocial personality disorder. Techniques include family therapy, psychodynamic techniques, cognitive behavioral therapy techniques, attention deficit hyperactivity disorder. Techniques include client education, group therapy, individual counseling, parent counseling, education, pharmacological treatment, CNS stimulant, school intervention, social skills training. Atypical eating disorders, cognitive behavioral therapy techniques, Socratic dialogue, self-monitoring, behavioral rehearsal and role-playing, problem-solving skills, modeling, decatastrophizing, what if, reattribution, redefining, decentering, stress inoculation, cognitive restructuring, systematic desensitization, homework, behavioral experiments, psychoeducation, bibliotherapy, cognitive reframing. Psychodynamic therapy, transference, exploration of dysfunctional patterns, relationship history, discussion of dreams, childhood memories, hypnotherapy, interpersonal psychotherapy, unconscious conscious, as well as interpretation. Interpersonal psychotherapy. Bipolar 1 disorder. Techniques include cognitive behavioral therapy, psychodynamic therapy, rational emotive cognitive behavioral therapy, which include family intervention with behavioral therapy, family treatment, pharmacological agents, and psychoeducation. Body dysmorphic disorder. Techniques include cognitive behavioral therapy, Socratic dialogue, self-monitoring, bibliotherapy, and cognitive reframing. Borderline personality disorder. Techniques include cognitive behavioral therapy, dialectical behavioral therapy, supportive therapy. Breathing related sleep disorder. Behavioral therapy techniques include medication, residential treatment programs, day programs, combined school community facilities, techniques that focus on consequences, reinforcements or rewards, cognitive strategy, anger management. Brief psychotic disorder. Techniques include psychoeducational approach, cognitive behavioral therapy. Bulimia nervosa. Bulimia nervosa. Techniques include cognitive behavioral therapy, family therapy, interpersonal psychotherapy, psychodynamic therapy, psychoeducational approach. And that is an overview of some of the therapeutic counseling techniques.